everyone, and welcome back to another episode of 5 Minutes in GI. Today, we are back with Dr. Joy Liu, who is a GI physician at Northwestern University in Chicago, Illinois, and is also one of IFFGD's junior academicians. Dr. Liu joined us in a previous episode back in 2024, where we were able to discuss diet for diverticulitis. We are so happy that you were able to be back with us again on another episode.
Thanks for having me again.
Of course. So let's just dive right in. Today, we're exploring a topic that affects many women during pregnancy, which is gastrointestinal symptoms. And those can range all the way from nausea to heartburn to constipation. And these symptoms, while often common, can be difficult to manage. So I was hoping you could talk a little bit about the most common GI symptoms that women can experience during pregnancy and also how they can navigate these symptoms.
Yeah, so GI symptoms can really range throughout pregnancy. And I think all of us are very familiar with the term morning sickness and the nausea that can often occur in the first trimester of pregnancy. So nausea is very common. And for many women, is often a sign of pregnancy in the beginning stages. We typically expect nausea to be, most prominent at the beginning, and then hopefully by weeks 12 to 14 to have subsided at that point. Some women may continue to have nausea throughout the pregnancy. And we think that nausea is related to hormonal changes that occur, in particularly the increase in progesterone, and to a certain extent, estrogen that occurs with pregnancy. Along with this, hormonal changes can also lead to increased heartburn and reflux symptoms, or the feeling of regurgitation and being able to taste acid in the back of your mouth. This is also related to hormone changes. And constipation, lower down in the GI tract, can be common. Most of the time people notice it towards the end of pregnancy, but it can start as early as the first trimester, again, also due to hormonal changes. So, in terms of managing these symptoms, we know that the underlying issue are the changes that are naturally occurring in one's body. And again, hormones being the most significant contribution at the beginning. And then going into the third trimester, just having a increased weight in the belly and the effect of the fetus there can lead to GI symptoms as well. We still recommend treating symptoms with lifestyle and medications that we believe to be safe in pregnancy. Unfortunately, lot of studies looking at safety of prescription medicines in pregnancy. It's very hard to conduct those kinds of studies, but some medications that we do think can be helpful for a variety of symptoms can be discussed either with your OB or your GI doctor, and we can get into some of those more specifics if that's of interest.
Yeah, I think you kind of touched on everything. I know that pregnancy symptoms can be different for every woman. Some women may not experience any morning sickness. Some women may only experience constipation. Some may not experience any at all. And so I was hoping you could also touch a little bit on, I know this is kind of more of a taboo topic for many women. They don't want to discuss it. But when you have that constipation and it lasts your whole pregnancy, sometimes you can experience hemorrhoids with it. And so I was hoping you could touch a little bit on that and when those may be a concern.
Yeah, so hemorrhoids, unfortunately, it's part of the deal. um, hemorrhoids are actually a natural structure in the body. Whenever I do colonoscopies, I tell people I'm surprised if I don't see hemorrhoids on the inside.
Oh,
But for many people, they're never bothersome. You never know they're there. However, in pregnancy with constipation, you can have increased straining, and then just having all that extra weight in the belly and putting that pressure on the pelvis also causes hemorrhoids to grow. For some women, particularly who have very long pushing sessions or prolonged labor, that can also be a situation that makes hemorrhoids more prominent. And so they may, be sort of uncomfortable bulges at the rectum. You may be straining to have a bowel movement and feel like you're pushing against something and it almost can't come out because there's a hemorrhoid there. I think that hemorrhoids often get smaller after delivery. And unfortunately, there's no way to deal with it during pregnancy except to avoid straining. So, perhaps increasing the amount of fiber you take Miralax 1 to 2 times a day to keep stool soft so you don't have to strain. But really, it's not until after, baby is out that you can probably expect hemorrhoids to get better. After delivery, for some women, hemorrhoids do become an ongoing issue afterwards, and we might talk more about that in a later episode. But in general, we don't recommend surgeries to remove hemorrhoids or deal with hemorrhoids. Soon after a woman has delivered a baby, particularly if she's thinking about becoming pregnant again, just because the same circumstances can lead to hemorrhoids enlarging again.
Right, that makes sense. Thank you so much. And I know you kind of touched on it that one, there's not many studies that discuss different prescription medications that women can take and the safety of those medications. And so I just want to mention for all the women out there that either are newly pregnant or are unsure of what they can take to help manage their symptoms, that it's so important that you talk with your OB or primary care doctor or a GI physician because they will have a list of medications that are considered safe to take during pregnancy, and that should be able to help you throughout your journey.
Mm. I should mention too, sometimes I'll get questions from women who are planning to become pregnant and they're already on some of these prescription medications, like linaclotide or Linzess for constipation, very common in our patients. And so people will ask, should I stop taking this medication if I'm thinking of becoming pregnant? And I think that really does require that individual discussion with your clinician, because for some women, the answer might be, it's not a big deal. I'll just go ahead and stop it and we can see what happens. For other women, it might be a situation where constipation has been so severe that their clinician recommends that they continue it. And in fact, there are some, case studies or individual reports of patients who have been started on those medications during pregnancy because of their individual circumstances. So it really will depend on your situation.
Thank you so much for mentioning that. That's so important. That's all the time that we have for today. Please don't forget to hit that subscribe button. And as always, if you have any questions after watching this video, please feel free to email us at iffgd@iffgd.org, and we'll do our best to answer your question in another episode of 5 Minutes in GI.